Hello, everyone. Thanks so much for joining us for today's presentation entitled Emergency Planning for Individuals with Intellectual and Developmental Disabilities. Today's webinar is hosted by Caregivers of New Jersey, which is part of the Family Resource Network, or FRN for short. FRN is a network of nonprofit organizations that's been supporting individuals with disabilities and chronic conditions along with their families since 1970. Through its affiliates, including Epilepsy Services of New Jersey, Autism Family Services of New Jersey, and Caregivers of New Jersey, FRN connects people to community-based services, education, and training. Annually, FRN supports over 35 individuals through direct support and 80,000 individuals through training and education throughout all 21 counties in New Jersey. So today's presentation is all about emergency planning for those who have disabilities. And I can't state this enough, but emergency planning, I should say effective emergency planning, is crucial for individuals that have disabilities. And it's not only important to plan for fires and natural disasters, but also for what most families really don't want to think about, and that is, well, what's going to happen and what am I going to do if I, the primary caregiver, can no longer provide care? And so these are the topics that are going to be included in today's discussion. And what we're going to start with first is we're going to talk about making an emergency plan as well as an emergency kit. So as we think about just general emergency planning, it's very important that you think through your specific situation. And I might be talking to primary caregivers and parents today, or maybe you actually are an individual with a disability and you want to learn about emergency planning. So one of the things I really want to focus and stress is that emergency plans are not one size fits all. You know, and what I mean by that is, well, you might live in a certain area of the country to where there's tornadoes, and others of you might live in an area where there's lots of hurricanes or flooding. And so you want to think about what kinds of disasters and emergencies could occur near your specific location. And you really also want to reflect and think about how your loved one or how you would be affected if one of these emergencies would occur. Individuals that have intellectual and developmental disabilities have specific needs. And so as you're thinking through emergencies, you really need to think about the specific person's needs. So as you think about making an evacuation plan, for example, these are some things to consider. How will the person get out? Can they evacuate an area independently? Might they actually need to be told that there is an emergency occurring because they can't identify one on their own, and maybe they would need verbal prompting to evacuate? Maybe they would actually need handheld guidance, or perhaps someone is in a wheelchair and they would need to be physically lifted out in their wheelchair, or lifted out of the wheelchair and carried out. How will they get out? Where will they exit? You know, and this would be dependent upon where they live. Are you going to go through the front door, the back door? What happens if you live on the second floor? Where are the nearest exits to where you live? And then it's not just thinking about, you know, how you'll get out and where you'll get out, but what are you going to do once you get out? Are you just going to go wait in the street? Maybe you live in an apartment complex or condo complex, and you would need to go into the parking lot. Or do you need to go to a safe space, like a neighbor's house? And if so, which neighbor would that be? So as you're thinking about emergency evacuation plans, those should be some considerations. You also want to think about where you might go if you can't get back into your home immediately. It's always a good idea to know where the nearest shelters are in your town. You know, shelters typically will have the basic necessities, but they're never meant to replace your actual home. So while some locations might have canes or glasses or walkers, they may not have the assistive technology you need or medical equipment that you or your loved one might require. So it is always best to call your local shelter before an emergency occurs to find out what they do have and how they might be able to accommodate your needs. Again, doing this before an emergency occurs is so important. Now let's talk about medical emergency plans and what should we consider as we are thinking through an emergency plan. We just talked about evacuation plans. But some medical emergencies that might occur might be if someone chokes, there's seizures or aspiration, pica incidents, or maybe even just general household accidents in regards to chemicals or knives or the stove. Some things to consider. Do you have a seizure protocol in place? Do all of those that support you or your loved one know what to do in case a seizure were to occur? Is it openly posted somewhere? Are your supporters trained in what to do during a choking incident if one were to occur? Are they trained in CPR? Have a first aid kit readily available at all times and make sure you know where it is. You also want to have the poison control phone number visibly posted somewhere. Some additional considerations for emergency planning. You always want to make sure that you have a support network of people who can help you in the case of an emergency or a disaster. Keep that contact list of people as well as your emergency kit either on you or on your electronic device. Have it on your refrigerator, have it on your cell phone. You need to have those go-to people that can support you or your loved one readily available in case an emergency were to occur. You also want to make sure that those supporters know where you keep your emergency supplies. You may want to consider giving someone a key to your house or your apartment in case of an emergency. If you need transportation, it's important to know where you're going to go to access that transportation in the case of an evacuation or some sort of disaster. It's important to plan ahead. It's also a good idea to check with local transit providers as well as your emergency management agency that's local to you to identify appropriate accessible options. They can help with that. Those individuals who might be on life-sustaining medical treatment or dialysis, you also always want to know the location and availability of more than one facility that can help you. If you do use medical equipment in your home that requires electricity, make sure you talk to your doctor about what you should do in case there was a power outage. You have emergency generators available. You can also ask your power provider to put you on a list for priority power restoration. So let's just say you do need power at all times where it could be life-threatening to you if you lose power. You can call your power provider so that you are put on a priority power restoration list. For those of you that might live here in New Jersey and have a budget with the Division of Developmental Disabilities, if you are in need of, if it's crucial to you to have this medical equipment, you can use the DDD budget to purchase power generators. So that's something to keep in mind. When it comes to all of your prescriptions and medications, keep in mind that pharmacies may not be open, so it's always a good idea to have extras around the house for just in case. When appropriate, maybe you want to make sure you have a medical alert tag or bracelets for you or your loved one, making sure to always have that medical information on your electronic devices as well. You also want to consider maybe having a personal emergency response system or device available. Again, for those of you that have a DDD budget, you can use the budget to purchase these devices in case of emergencies. If your loved one has a disability that affects their speech or communication, it might want to consider carrying printed cards or storing information on devices so that first responders might know how to best communicate with them. This is something most people would not think about, but for emergency responders, this would be helpful information if you could get it to them somehow. It's just something to keep in mind. If you or your loved one use assistive technology devices, you want to make sure that you plan how you'll evacuate with those devices, or, if you can even replace those types of things if they're lost or destroyed. Are there warranties? Do you have insurance on these things? Thinking through things like that, again, it's not typically common, but good to keep in mind. If your loved one has difficulty in stressful, chaotic, and unfamiliar environments, you want to plan for this as well. If you have support animals or pets, you want to make sure you're planning to evacuate for their needs as well, whether it's food or water. Find out whether your local shelter will allow pets or not. And if not, will they at least accept a service animal if you have one? So lists are important, I will say. And so you always want to have an openly accessible list of things like your nearest hospital, phone numbers of important medical providers, address and phone numbers of the nearest shelter, like we've said, local poison control, as well as all of those phone numbers for those in your support network. Now, I do want to mention New Jersey's Office of Emergency Management Notifications. And this is a way for you to be able to monitor the conditions around you if a disaster or specific emergencies were occurring statewide, or at least specifically to your location. I do have their website listed there, but it's a great way to stay informed for types of things that might arise. Most counties and even some local towns have their own emergency management offices. And so there is a list of all New Jersey County coordinators and their websites if you do go to this link. Now, I realize that you guys are watching this webinar, and so if you would like a PDF of today's presentation, which will have those live links, feel free to email us and request that, and the email address will be given to you at the end of today's presentation. FEMA is also a great resource. They will send email alerts or text alerts if you subscribe to them online, but just keep in mind that you might get a lot of incoming notifications. It might drive you a little bit crazy, but they are a resource available. There's also a FEMA app that you can download on your devices, and they will provide real-time weather alerts, safety and disaster resources as well. So that's another resource you can check out as well. Another thing I want to share with you guys today is something called Register Ready. This is New Jersey's Special Needs Registry for Disasters. So what Registry Ready does is it allows New Jersey residents with disabilities or those who have access and functional needs and their families an opportunity to provide information to emergency response agencies so that emergency responders can better plan to serve them in a disaster or other emergency. So what you would do is you would register with Register Ready, and registered individuals will be notified by local officials when an evacuation has been ordered. This is something that's voluntary. It's also confidential. All New Jersey counties participate. They utilize a database to plan for their residents with special needs. This is a great resource I highly recommend you check out at registerready.nj.gov. You could also register by phone to speak with an operator who could help you register as well. Now, while this is a great resource, one thing to keep in mind is that just because you register with Register Ready, it does not guarantee direct assistance in every emergency situation. But what it does do is it significantly helps emergency planners prepare for the needs you might have during an event. So definitely check out Register Ready. There's also something called Smart 911, and this is a free, secure service allowing you to create a digital safety profile that will have vital information like your specific medical needs, addresses, photos, pet information for 911 dispatchers. So what happens is when you register for this, the information will automatically appear on 911 dispatchers' screens when you call from a registered phone. And what that can do is it can enable faster, more informed emergency responses. What it does too is it bridges the information gap from mobile calls. So it gives first responders critical details in regards to your specific location, your specific special needs, so that they can better assist you, even if you can't speak. And so you can sign up for this at smart911.com. What you'll do is you'll create a profile, add details about your specific household, phone numbers, your medical conditions, vehicles you have, your emergency contacts. You can also link your devices, which is great. And what happens is when you call 911 from that linked device, your profile automatically pops up on the 911 call taker's screen. So really, this is another great resource I recommend you check out. So we're going to switch gears a little bit and talk about emergency kits and how to build an emergency kit. Now, some of you may already have an emergency kit. I know there have been specific times in my own family where we have had emergency kits. Well, we actually still do have one. But I want to talk about general emergency kits and things specific you should have for those with disabilities. So what we want to think about is in the event of an emergency or a disaster, could you or your loved one manage on your own for several days? You know, it's crucial to think for your daily needs and know what you would do if they become limited or even unavailable. None of us want to think about this, but we should be. And the easiest way to do this is by making an emergency kit. Being prepared means, you know, you have your own food, water, and some other supplies to last for several days. So an emergency kit is a collection of basic items you or your household might need in the event of an emergency. So a basic supply kit, what should be in it? Well, definitely want to have water. It's recommended to have 1 gallon per person per day for several days for drinking and sanitation purposes. A portable water filter, again, let's just say water's contaminated. You need a way to filter it so that you can use it. Food, it's also recommended to have several days of non-perishable food. You also might want to research local food pantries that you might have in your area in advance so that you know where to turn in case of an emergency. Let's just say there's a house fire and you find yourself without a home for several months. Obviously, you know, you would reach out for help and go to a shelter or a family member's home, but you might need some additional help, and so a food pantry might be helpful. A battery-powered or hand crank radio and a flashlight. First aid kits, extra batteries. These are all things that you want to think about having in a basic emergency kit. These items should also be stored in airtight plastic bags, and everything should be put into containers like plastic bins or duffel bags, something that you can quick grab and take with you if needed. Ready.gov actually has a lot of information. They have printable checklists you can print out. and a list of important supplies that should be included in emergency kits. Another great thing is it's available in several languages as well. I'm not going to go through all of these lists because I get that it can be overwhelming, but these are some additional items that are recommended to be in emergency kits as well. So things like sleeping bags, matches, utensils, papers and pencils, soap, hand sanitizer. You get the idea, but these are things to keep in mind. Now, some additional items to consider for those who might have disabilities. You want to think about your prescription medications that are very important for you. Talk to your doctor or pharmacist about how you can create an emergency supply of medications. You want to keep a list of your prescription meds. You want to keep information about your diagnosis, the dosage and frequency, any allergies you might have to medications. You always want to also think about non-prescription medications as well, like painkillers, antihistamines, antidiarrheal medications, and acids or laxatives. You want to keep these in your emergency kit as well in case you need them. It's also a good idea to keep a cooler or ice packs available for any medications you might have that have to be chilled or be refrigerated. Because if you lose power or you need to take them on the run, these things would be important to have. Other things to think of too that you might have, eyeglasses or contact lenses and contact solution. Any adaptive equipment you might have, like adaptive feeding equipment, you want to have extras of those. We already talked about portable generators. Those would be important for those with medical equipment. Extra batteries or chargers for this type of assistive technology, and any extra medical supplies for specific medical needs you might have. So while it's important to create and have an emergency kit, it's also important to make sure you maintain it. So any canned food that you have, you want to keep in a cool, dry place. Make sure you're storing food in tightly closed plastic or metal containers or bins, like I mentioned. This is a big one. A lot of us create these kits and thank God we don't need to use them, but next thing you know, a few years have passed and a lot of your canned goods or some other dry goods might become expired. So you want to make sure that you're replacing those and going through your kit, every year or every other year, just to make sure you're keeping things that aren't expired. And also your family's needs might change or your loved one's needs might change. And so you might need to rethink those things from year to year. Since you don't know when or where an emergency is going to occur, I hate to say it, guys, but you want to prepare supplies for both at home and away from home. So keep your home emergency kit in a designated place that you know where it is and those in your family know where it is and that it's ready so that you can quick grab it and go. But it is also a good idea to keep another smaller emergency kit that has some basic supplies in your car as well. Here now I want to go into some disability specific emergency tips to keep in mind. For those who might be deaf or hard of hearing, there are weather radios out there that have text displays and a flashing alert in case they cannot hear. You want to make sure you have extra batteries for your hearing aids, pens and papers so that you can be communicating with someone that maybe doesn't know sign language. This way that person can communicate with emergency responders possibly, for example. It's also a good idea to have a battery operated lantern to enable communication by sign language or lip reading. So again, if the electricity is out and it's dark, how is someone who's deaf or hard of hearing or mute going to be able to communicate? Emergency tips for those who are blind or visually impaired. So there are braille labels that you can purchase, or labels that have large print. So you want to mark your emergency supplies with braille labels. Keep a list of your emergency supplies and where you bought them on a portable flash drive, or make an audio file so that it's kept in a place where you can access it. Make sure you keep communication devices for one's particular needs, such as braille. I'm having a hard time with that word. Such as braille or deafblind communication devices as part of your emergency supply kit as well. If you or someone you support has a speech disability, they might have a communications device or some sort of other assistive technologies. Plan for how you're going to evacuate with those devices, or how you can replace them if it gets lost or destroyed. These devices are very important for specific individuals, so you want to think about what happens if they're destroyed. Make sure you have the model information of these devices, maybe a note where you purchased them, whether maybe it was purchased or you received it from private insurance or Medicaid or Medicare. You also want to plan how you're going to communicate with others if your equipment's not working. So maybe laminated picture cards with phrases or pictograms on them. That might be a good idea as well. For those with mobility issues, so if you use a power wheelchair, you want to make sure you have a manual, a lightweight manual, as a backup if possible. Making sure you show others how to assemble or disassemble and operate your wheelchair in case of an emergency. Purchase an extra battery if you do have a power wheelchair, or other battery-operated medical or assistive technology devices. We've mentioned this. If you can't purchase an extra battery, find out what agencies, organizations, or maybe there's some local charities around that can help you buy one. Keep them charged at all times. Consider keeping a patch kit also, or a can of sealant if you were to have a flat tire on your wheelchair as well. Again, these are like a lot of details, and I get that, but these are things many times often we don't think about. If you can have an extra mobility device, such as a cane or walker, if you use one, it's great to have an extra one on hand. A portable air pump for wheelchair tires. Let's just say you are someone that you need to think about skin integrity. In case you were to evacuate, you want to have extra cushions as well. Make sure you communicate with neighbors who can assist you if you need to evacuate the building. If you are someone that lives on their own and you don't have immediate support or caregivers, you have to come up with a plan who might be able to help you in case of an emergency. Now, for those who might have other types of disabilities, you want to keep handheld electronic devices charged and loaded with videos and activities. Purchase spare chargers, keep them charged. If you are someone that maybe has a lot of sensory issues, whether it's to loud noises or bright lights, maybe have a pop-up tent so that you can decrease that stimulation. Let's just say you were to go to a shelter and you have someone that gets overstimulated easily. You're going to need to think about a way to sort of create a safer space, a quieter space for them. Consider also maybe noise canceling headphones that can also decrease auditory stimuli. Have comfort snacks available. Maybe you are your loved one, there are some behavioral triggers, and an emergency situation where the routine's changing. What would help your loved one in that case? Is it certain snacks, certain toys, certain sensory toys? You want to make sure you have extras of those things, fidgets, things like that. The biggest thing I would stress for all of this, everyone, is that your loved one is unique. You know them best and you know their specific needs. So you want to always keep these things in mind as you are planning for emergencies. Okay, now the second part of our presentation, when we think about emergency backup planning, we need to talk about planning for when the primary caregiver is unable to provide support. And let's face the obvious in this. This is an uncomfortable conversation to have. It's an uncomfortable thing for many families to even think about. But even though it's a difficult topic to think about, it really is crucial to plan ahead and consider what should be done if the primary supporter or family member can no longer provide care. You know, this might be due to temporary illness and surgeries a primary caregiver might have, or if they're injured or hospitalized, or even death. And again, we don't want to think about what will happen when we're no longer here. But planning ahead will increase the likelihood that your wishes are respected and that your loved one is going to be cared for in a way that best meets his or her needs. So in order to start planning for this, and we've mentioned this before, but you want to identify who your support team is. These are people in your loved one's life who are most important to them. You know, those people around you that help and listen and support, they get along with you or your loved one. It can include family, friends, neighbors, paid direct support professionals or coworkers, anyone who is committed to help support your loved one if you can't. Now, it's important, I probably shouldn't need to say this, but I'm going to say it. It's important that you ask these individuals if it's okay that they are added to your support network. You don't want to assume like, oh yeah, he loves my daughter, you know, or she loves my daughter. They've known her forever. Don't assume that they would be willing to be put on this support network and take over care if you cannot. You want to ask them and make sure they're okay with it. These support network contacts should be listed in order of who should be contacted first, then after that, and so on. Think about who can support your loved one if your typical supporters are unable to do so. Make sure that this list is readily accessible, or even better, openly visible. Make sure their names and phone numbers, addresses, email addresses, and the relationship that they hold to you or your loved one. And make sure each person in this support network has a list of all of these members so that everyone can be communicating with each other in case an emergency were to occur. The other thing you want to do is provide your support team with information. So make sure they have medication information for you or your loved one. The physicians, your pharmacy information, allergies. Is there current guardianship in place, or do you currently have power of attorney in place? If so, you want to make sure they're aware of this. Other specifics for your loved one, if you're the caregiver watching today, information about how your loved one communicates, their support needs that they might have, whether that might be mobility or supervision needs, behavioral needs. If you're in the state of New Jersey and you have DDD services, make sure you keep a copy of the ISP and the PCPT if there is one. Some other important documentation to have readily available. So if there are important papers or documents that you might need that provides vital information, you want to make sure you have these documents readily accessible. You want to make sure you gather them in place and put them in a waterproof bag and store them in a safe place where they can be accessed in case of an emergency. Make sure your support network knows where this place is. So some documents I might be talking about are copies of driver's licenses or IDs, social security card of your loved one, Legal papers like their birth certificate, guardianship documents, power of attorneys, living wills and DNRs. Your insurance policy numbers and information should be included. If there's any advanced directive documents, and again, if you have an individualized service plan or person-centered planning tool, it's great to have those so that your support network will have these documents and know how to best support your loved one. Also, things like bank account information. If you have a co-signer on your account, it would be important for them to know that. One thing to think about also when commingling money, you have to think about these things. It can affect Medicaid eligibility because Medicaid eligibility is based on strict income and asset limits. Same with SSI, supplemental security income. So if something were to happen to you and your loved one is in the will and they're going to get a huge amount of money, this will affect SSI and Medicaid. And so it's best really to maybe meet with a special needs lawyer to discuss emergency planning and putting things in place so that they would not lose any government benefits that they currently receive. Some other things to think about would be copies of current prescriptions, manuals and warranties for any medical or adaptive equipment your loved one has, maybe a copy of your utility bill or other mail with your name and address to prove your residence as well. Now, for those who might be the legal guardian for their loved one, it's important to think ahead and plan for who might assume the role of guardian if something were to happen to you. Again, we work with families all the time to where they really don't want to think about that because they don't think it will happen, or they say they'll think about it and the years pass by and they really don't. So again, I can't stress enough, plan ahead so that it doesn't become an emergency situation where you don't have say in the outcome. Here are some resources used for today's presentation, and I hope that, even though this information can be overwhelming, I get it. There was a lot of details in this presentation, but I do know and I do believe that it will be helpful to you so that you can begin to plan for emergencies, both disasters, general emergencies, and even if something were to happen to the primary caregiver. For those of you that do have DDD services, your support coordinator can help you walk through a little bit of this in terms of helping you plan in the case that you were not able to provide care to your loved one. We're here to help answer any questions you might have. If you need some one-on-one assistance or you have questions, feel free to reach out to us. Allison Warwin, our trainer and support coordinator supervisor, you can contact her directly. Her email address and phone number is there as well. We do provide support coordination in the following New Jersey counties, so if you ever need a support coordinator, feel free to reach out and we could help answer any questions you have about that as well. Thank you again so much for joining today's presentation. I hope it was helpful. Have a great rest of your day.